Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. First of all, I would like to thank Dr. Anam who invited me for today's talk, and at the same time, I would like to thank and congratulate the organizing committee of this virtual dental conference. I was told that the target audience for this presentation will be general public and the fresh dental graduates and dental graduates. So I tried to keep my topic and content very simple and easy to understand. Topic for my today's talk is perks of early orthodontic care. Here is my brief introduction. My name is Muhammad Abdullah Kamran. I did my graduation from Karachi Medical and Dental College in 1999, and then I started my teaching career in 2001 from Liaquat College of Medicine and Dentistry. Then I got the opportunity to join the residency program under the supervision of great Dr. Arif Alvi, which I completed in 2010. Till 2016, I served as head of department orthodontics in Liaquat College of Medicine and Dentistry. This is the place where I am currently working as associate professor in the Department of Pediatrics and Orthodontics, King Khalid University, Saudi Arabia. So coming to my today's talk, which is about oral health awareness. Why oral health? Everybody knows that oral health is a gate to overall health. Our oral cavity is the entrance point of the food, the nutrition, at the same time, the germs and bacteria. If we can keep our oral cavity healthy, oral health sound and safe, we can preserve our oral health and we can maintain our overall health. What is the role of orthodontics and orthodontist in keeping the oral health safe and sound? Orthodontic treatment facilitates appropriate function of teeth and jaws and produce healthy smiles. Very frequently asked question by our family members, relatives and friends and patients as well, that what is the right time for the first orthodontic consultation? As recommended by American and Canadian Association of Orthodontists, it should be around 7 years. Why? Why it should be 7 years and what should we expect the outcomes of early visits? Your child might not require any treatment. He or she may need periodic follow-ups while the face and jaws continue to grow, or potential problems can be identified at that stage that demand early orthodontic treatment. As in all other fields, timing is very important. Same implies in the field of orthodontics that the timing is the name of the game. The 7th year is the age where first molars usually erupts and posterior bite is established. Anterior-posterior relationship of jaws is established. Potential problems can be diagnosed. And why orthodontists? Because orthodontists are the only people that can diagnose potential developing problems in an otherwise straight and good-looking teeth. Does it mean the right time for ortho treatment is 7 years? Definitely no. Then what is the right time for the orthodontic treatment? As soon as the malocclusion is diagnosed or after the eruption of all permanent teeth. Most of the orthodontists have consensus in certain cases that all permanent teeth should be erupted before the start of orthodontic treatment, but it varies from case to case. We all are aware of the different branches of orthodontics, out of which my field of interest is preventive and interceptive, which I am talking about today in brief. So, one more question comes in our mind, that is there any orthodontic emergency or any condition which needs an urgent orthodontic care? Yes, anterior and posterior cross bites, especially with functional shifts. As surgeon says, sun should not shine over an abscess. Same implies with the anterior and posterior cross bites in orthodontics, especially with functional shifts. Why? Because if left untreated, it can lead to crossbite in permanent dentition. It can lead to a skeletal asymmetry, gingival recessions and mobility of teeth, TMJ dysfunctions, and asymmetric muscle activity. At this stage, usually the management is very simple, starting from the selective grinding of some teeth to the expansion with a removable appliance. And it is thought to decrease the risk of crossbite being perpetuated to the permanent dentition. Here are some cases which were diagnosed at the right time and intercepted at the right time to achieve the maximum benefits. Here you can appreciate the gingival recession associated with the tooth which is in crossbite, which is a very potential problem, should be diagnosed as soon as possible and should be treated as early as possible. One more case with a class 3 development, anterior crossbite, midline shift. Another case of a crossbite, narrow arch. Other condition which indicates the early orthodontic care is class 3 malocclusion with maxillary deficiency. Especially if protraction headgear is planned, treatment should commence in the mixed dentition for maximum benefit. Severe crowding is one of the conditions in which correctly planned early extraction of teeth for the relief of crowding may result in increased long-term stability, particularly in the lower labial segment, hence simplifies the appliance mechanics during active treatment. बट यहाँ पर एक चीज कंसिडर करने वाली है, there are some cases in which patient comes to you at the age of 6.5 or 7 years of age with the lateral incisors erupting lingually, and there is no space for the arrangement of lateral incisors in the arch. People usually suggest extraction of deciduous canines at this stage. But my suggestion is think multiple times before you plan extraction of deciduous canines. Because till the age of 8.5 years, the intercanine width increases and the problem usually resolves by itself. And if we go for extractions early than this age, it might lead to collapse of the dental arch, leading to the deep bite or resulting in deep bite. So better to not to extract at least till the age of 8 years and observe. Supernumerary teeth are the other conditions which results, as you can see here, in midline diastemas, ectopic eruption of canines. If these conditions are diagnosed and intercepted early, these potential problems can be avoided. Another case of supernumerary tooth resulting in displacement of permanent central incisor and gingival recession of the lower incisors. The risk of trauma to the upper labial segment may justify early treatment of class 2 division 1 cases. Habits like thumb sucking, mouth breathing, tongue thrusting, they also are indications for the early orthodontic care to avoid malocclusions in the permanent dentition. Most orthodontic treatment can be started in the late mixed dentition just before the loss of primary mandibular second molar. This will maximize growth potential and compliance, allow for utilization of the leeway space, and keep overall active treatment time as short as possible. Now, one more condition, that is midline diastema. We all are very well aware of this stage that is known as ugly duckling stage. This condition resolves by itself once the canines erupts, because it is a transitional phase, temporary phase, physiological condition which resolves by itself. But if we try to do early treatment of midline diastemas in ugly duckling stage, it might result in canine impaction. Why? Why is that so? Because you can see the roots of the lateral incisors plays a role in the guidance of canine eruption. And if we try to close this space, midline space earlier, canine might lose its guidance and result in palatal displacement or impactions permanently. But there are certain conditions where midline diastema is more than 2 millimeters, not resolved after the eruption of canines, and the thick lingual frenum indicates the treatment as well. So, when early treatment is contemplated, especially if it involves the use of active appliances, following questions should be asked by ourselves. Will early treatment correct the problem or eliminate the need for comprehensive treatment? Will it reduce the risk of trauma to susceptible incisors? Will it really reduces the severity of the problem to make a second phase of treatment easier and shorter? Will early treatment result in greater skeletal change than treatment during the growth spurt? Will early treatment create problems or reactions that are undesirable? Will early treatment have a beneficial psychological impact on patient? To summarize this all presentation, the benefits of early care. It reduces the need to extract the permanent teeth. It reduces or eliminates the need for jaw surgery, an opportunity to guide the growth of the jaw, guide incoming permanent teeth into desirable positions, lower risk of trauma or injury to protruded front teeth, correct harmful oral habits such as thumb and finger sucking, maintain or gain space for the permanent teeth that are coming in. It may minimize the need for more extensive and costly procedures later, reduces or eliminates the abnormal swallowing or speech problems, assess and treat airway, breathing, and excessive snoring problems. That is my usual wish, that if you can't make me thin, make my friends fat. Now, the second part is, who should we go for orthodontic treatment? According to my opinion, it's a teamwork, but the team members should be cooperative and supportive and not the deceiving. The key role in the team is by general dentist, which I call a family dentist, because patient comes to us with a full trust and belief in us. So we should help them as much as possible by ourselves, or which we can take the help from the other specialist, concerned specialist. I think this is a self-explanatory picture that a wise person knows his limitations. The take-home message from my presentation is, doing the right thing at the right time can make the difference. Our primary objective should always be patients' well-being. Don't hesitate to refer patients which are beyond limitations. Thank you very much for having me and bearing with me.